Welcome everybody to the Spring ORN conference, and I can see from all the messages that have been coming in, some of you are enjoying this amazingly beautiful sunshiny morning, so thank you for joining us on such a beautiful morning. I am Bridget Hall. I am, in my day job, I'm Head of Recreation and Visitor Experience for Forestry England. But I also share the chair role with Pippa Langford from Natural England for the Outdoor Recreation Network. And I will be your chair today, and Pippa will be your chair tomorrow. So you're very, very welcome, and it's great to see so many people here today. Actually, over the course of the next 2 days, we're expecting 250 people to join us. So we think this is probably our largest network event yet. As we have some new people joining us for the first time, I'm going to share just a little bit about the network to start off with. We've been going for about 50 years in one way, shape or form, and our vision right from the start, way back 50 years ago, was to encourage more people to enjoy and engage with the outdoors. And I think as a vision that is as relevant as today as it was back then. Our mission really is why we're all here today, and that's to collaborate and to share with you as participant and member organisations the latest thinking around the hot topics of the day. So that's very much about the next 2 days. We are a membership organisation largely, and because of that, we have some real strengths in the value to our membership and to the Outdoor Recreation Network going forward. There are very few places where we as countryside professionals can go for our CPD, and the Outdoor Recreation Network is one of them. This is why we put so much store into our professional reputations. And sharing that with you all. We really focus quite a lot on research and information and learning and development opportunities, which is why you're all here today. Our current membership is around 26 at any one time, different organisations, and I know there are many people from all of sitting around the table today, the virtual table today, from all of these organisations listed. But we're really pleased and proud to get some new people joining us today as well. So if you are interested in becoming a member, or any of your organisations are, then just do point yourselves in our direction, and there will be a link to our welcome to the ORN pack, which will go into the chat pane, should any of you want to join it after the end of the 2 days. So as I said, we're delighted that you can be with us today, and it is our largest event, certainly our largest virtual conference that we'll have ever run. So we've got people today joining us from across the UK and Ireland, and indeed our keynote speaker is all the way from Australia, although she's had to pre-record, so because of the time differences. So we are thrilled to have an international aspect to this conference. In preparing for today, I looked back 50 years, and I looked back at our archive for the first publications that the ORN produced back in about 1993, and it was really interesting that the topics covered then really are the same topics that we're covering today. So they were topics around training of recreation staff and professionals in the countryside, the need to address perceptions of safety for women in the countryside linked to International Women's Week, and accessible woodland design. They were all covered in the first publications back in 1993, and we've made huge strides as an industry since then. But it's interesting that all of those topics in one way, shape or form we'll also be covering again over the next couple of days. So we've come a long way, but we've still got a long way to go. The ORN particularly believes that now is the time for us to make positive changes. and to continue to modernise what we're doing in the outdoor sector. I think the importance of sort of green and blue spaces to our health and well-being has never been more apparent and is higher up the agenda than ever before. And certainly the benefits of being active in the outdoors, we know, are not enjoyed equally by all. We as the ORN are using this conference as the first step in providing sort of a razor-sharp focus on connecting more people to nature, including underrepresented groups, so that more people can reap the benefits. And really, we're going to explore key themes and key questions about how do we get more people moving, exercising and being more physically active more often. What groups are missing from the outdoors? What are the barriers to certain demographic groups, low income, BAME groups, those with disability, to join us in the outdoors? How can we meaningfully engage with underrepresented groups, and what steps should the ORN particularly take for the sector in order to address some of these questions? So we're using this conference as well as the ORN to sort of shape our future direction and future work on all of these areas. So you'll see the next slide up is about how do you engage with us during this event, especially as there are so many of us online. So you'll see that all the links we're going were in the PDF of the delegate pack, which you should all have. There are networking opportunities, and this is one of the things that the ORN is really good at providing networking opportunities across the sector, sort of getting us out of our organisational bubbles, to coin a phrase, and to be able to give you the opportunity to share and to work with and to talk with like-minded people. We've got a whole host of presentations which will be available to you afterwards, and quite a few live chat and Q&A sessions as well. So please put questions to speakers into the live Q&A session and engage as much as you're able to over the next couple of days. We really welcome that. So the running order, we've for the next couple of days, this morning we're really going to look at themes around wellness and the outdoors. And then this afternoon moving on to who is missing from the outdoors, what groups and why. And then tomorrow we will look at the practical things about the steps to address inequality and lack of diversity in the outdoors. Our running forward order for this morning, we're going to start with our keynote speaker, Jo Hopkins, who, as I said, has sent us a piece from Australia. I will introduce Jo a little bit more fully in a moment. We're going to then move on and look at some of the COVID-19 trends and patterns. A meeting is never complete at the moment unless we have that topic on the agenda. So some of the things that have emerged and some of the opportunities that have emerged as a result of COVID-19. Then you'll have an opportunity to stretch your legs, have a cup of tea, and then we're going really into the movement side of things. So movement as prevention and movement as medicine, the green social prescribing type of work, followed by a Q&A session and then lunch. And really importantly, lunch is divided into two: a chance to get out and enjoy the sunshine, which I know some of you have got, and also a networking lunchtime opportunity. So that's going to be the sort of the running order up to lunch. Okay, so now I'm going to hand over to our keynote speaker, Jo Hopkins. Jo works for Parks Victoria. She's also a supporting partner of the chair for the Health and Wellbeing group IUCN World Commission on Protected Areas. I think she wins the prize for the longest job title that we have speaking over these couple of days. She is a senior executive with protected area management with a keen interest in the human health and wellbeing benefits of contact with nature, something I think we all appreciate at the moment. Her core skill is bringing people, organisation and ideas together and doing complex and innovative work. Jo is passionate about nature conservation and creating long-lasting partnerships focused on protecting and enhancing ecological systems and human health. She's chaired and been a key spokesperson representing Victorian and Australian environmental interests on many national and international stages. So we're really thrilled and pleased to be able to share with you Jo's presentation, and I'll come back to you when she's finished. Thank you.
Good morning. It's a pleasure to be here and to be invited to be part of the Outdoor Recreation Network Conference 2021, all the way from Australia. My name is Jo Hopkins. I am the chair of the Health and Wellbeing Specialist Group for the World Commission on Protected Areas. I also work for Parks Victoria in Australia as the International Engagement Manager. I'm here to talk about one of my favourite subjects, the health benefits of nature and how much progress has been made in this area over recent times. I'm also going to touch on how important and relevant this issue has become, especially during the COVID-19 pandemic. Nature really is good medicine for people and communities alike. Nature provides the ultimate foundations of life and health, and this has long been acknowledged by Indigenous peoples for tens of thousands of years. In Australia, our Aboriginal people, the traditional custodians of the land, have a saying: if you care for country, country cares for you. This is a powerful message and reminds us that we are reliant on nature and the land for our existence, for our body, mind and soul. It also reinforces for us that to benefit from nature, we need to conserve and protect it. We are all part of the natural world. Today, it's parks and green spaces that are vital for people to access the health benefits of nature. And for many, parks are the first experience of nature and the gateway to the natural world. So imagine a life without nature. We know that sprawling urbanisation and shrinking natural places are disconnecting much of our global population from the natural environment. I am sure that this housing estate on the outskirts of Melbourne is a common scene all over the world. For several decades now, the way societies have evolved and the environments in which people live have been the subject of much concern. And when we think of a life without nature, the result is declining health. 2/3, that's 67% of Australians 18 years and over are overweight or obese, and that's over 16 million people, and a 56% rise since 1995. So over 20 years ago, Parks Victoria developed Healthy Parks, Healthy People, or HPHP, an approach to park and protected area management based on the concept that our healthy ecosystems support healthy societies. And a team of people within the organisation at the time took to branding the phrase and developing a framework around it. And so Parks Victoria's current HPHP framework focuses on the connection between nature, people and culture. Healthy parks make healthy people, and healthy people are the strongest advocates and stewards of our green spaces. So let's pause just for a minute and think about one of your fondest memories of childhood. Does it by any chance include time spent in nature, camping with family, fishing by a lake, swimming at the beach, or playing outside? Nature provides the essential services that are the pillars for all life on the planet, including human life. And in our modern societies, parks, and especially urban parks, are a key part of our contact and experience with nature. If a connection to nature is formed in childhood, that connection can last a lifetime. There's a lot of evidence to demonstrate how people are reliant on nature for health and well-being, and this evidence is growing and pretty easy to talk about. Several state of the evidence reviews by Deakin University here in Australia saw a huge influx of research on the health benefits of nature in the early 2000s and since. The evidence is easy to talk about and makes a lot of sense. Your blood pressure goes down, your stress goes down, and your heart rate goes down when you spend time in nature. And things improve when you're in nature as well. Your mood, cognitive function, quality of life, and so on. It is fair to say that the conservation sector, and in particular park and land management agencies, have taken a lead with regards to advocating for the health benefits of nature. There are now many organisations across many countries, such as England and Scotland, Finland, the USA, Canada, Japan, Korea, Colombia, New Zealand, and parts of Africa that are leading the way to develop integrated policy, build partnerships, deliver programs, and continue to build the evidence and grow awareness. And over the last decade, there have been some significant international events and milestones that have helped shape the health and nature agenda. And these major events drive partnerships, and the legacies created at these events live on. I'm going to go through just a couple of key milestones. So at the IUCN World Parks Congress in 2014, there was an entire stream dedicated to improving health and well-being. And National Geographic stated that the link between health and nature was in the top 5 of take-home messages for the entire significant event. One of our keynote speakers at the Congress, medical doctor Jonathan Patz, controversially said at the time, he said, and I quote, "As a medical doctor and public health scientist, it is in my professional opinion that conservation biologists can actually save more lives and prevent more illness than the health sector." At the 2016 World Conservation Congress, we saw the launch of Nature for All, a worldwide campaign to inspire a love of nature. And at its very core, the idea is simple. The more people who experience, connect with, and share their love of nature, the more support there will be for its conservation. And at that same Congress, over 8,000 participants passed a resolution, Resolution 64, which calls on the IUCN and the World Health Organization to work better together to strengthen cross-sector partnerships to recognise the contributions of nature to health, well-being and quality of life. And as a result of that, the Health and Wellbeing Specialist Group was established by the World Commission on Protected Areas to do a couple of things: to advocate, to mainstream the health and wellbeing benefits of nature, to facilitate partnerships, to influence policies and plans, and to continue to build that evidence and support others to do so. And I'll call out a couple of people who I know are in the audience, Kevin Lafferty and Bridget Finton, who are among the most active members of the Health and Wellbeing Specialist Group. Interestingly, a few months ago, at the most recent IUCN Council meeting, their new Director General, Dr. Bruno Oberle, announced that nature and health is the most urgent priority of the IUCN. So, focusing what's happening here and now, access. Access to parks has never been so important than during the restrictions and lockdown of 2020 and 2021. During the 100-day lockdown in Melbourne last winter, we were only allowed to exercise for 1 hour a day out of our homes, but within a 5-kilometre radius of where we lived. And during that time, I personally had never seen so many people out in parks. In London, a recent survey of over 3,000 people found that 70% reported that green spaces had a positive impact on both their physical and mental health and well-being during lockdown. There's a fascinating situation evolving in my local area in Melbourne, which is to allow more general access to an 18-hole public golf course. During lockdown, we were really restricted in our movements, and local residents reclaimed the public golf course for general recreation. Because if you didn't have a park close to your home, you were at a great disadvantage. How well populations and communities have done through COVID can be directly related to the proximity and access they have to parks and nature. Equity of access is central to the nature and health agenda. There is now a term for the disparity of access to nature, which then in turn leads to massive health inequalities, and that term is the equigenic effect. This is particularly prevalent in non-white communities and other economically and socially disadvantaged communities all around the world. The response to COVID-19, the restrictions and the lockdowns, I believe has really changed people's attitude to nature, especially in and around where they live. People in communities have developed a fiercely local mindset and will demand more access to nature, better nature, and more livable, healthy cities. Park and open space managers must think about how to multi-purpose assets. It's not good enough to have single-use assets anymore, especially those like golf courses. The responsibility for urban conservation and community resilience must be a shared one across all sorts of sectors, through government, business, and the not-for-profit sector, and each must rethink the role that it plays. In Victoria in 2017, a collaboration of conservation and health partners, I like to say, infiltrated the 15th World Congress on Public Health. I believe this was the first time that Healthy Parks, Healthy People and its message was delivered in the context of a public health congress rather than a conservation congress. This was also the first time that the IUCN and the World Health Organization jointly delivered a high-level dialogue, a leadership dialogue on the benefits of nature for human health. And this event kick-started significant policy reform here in Victoria. The signing of a memorandum for health and nature by the Minister for Environment and the Minister for Health commits the Victorian Government to better working together across portfolios to improve the health of communities and investing in the environment. Late last year, in 2020, the Victorian Government announced a $300 million investment into the environment and to parks and associated programs, and that included $54 million to maintain open safe spaces in urban parks, $29 million for bushfire biodiversity recovery, and over $7 million to support the extension of 51 seasonal park ranges for another 12 months. So there are opportunities in all of this and all of what's happened. The parks, health and other sectors are trying to address how to better collaborate across sectors to demonstrate tangible benefits as a result of the health and nature programs, and particularly benefits to the environment, and to better define the role of government, business and NGO partners. We really do. We need leadership. We need champions and partnerships that are mutually beneficial and with sustainable funding models. There is such power and expertise around the world to make the necessary changes, but I do think we need to get better at harnessing that expertise. So I'm now going to paraphrase Dr. Gus Speth. He is an environmental lawyer and a previous advisor to Bill Clinton. And he has said that previously he has thought that the most pressing environmental problems of our time were biodiversity loss, ecosystem collapse, and climate change. But he's since changed his mind, stating that the world's most pressing problems are now selfishness, greed, and apathy. And in order to deal with those problems, a cultural transformation is needed. COVID-19 may just be the catalyst for that transformation, and I am very optimistic about that. So thank you for your time this morning and for your consideration. I really wish I was there in person to have a vibrant discussion with you all, but I hope I've left you with some ideas that you can all further discuss throughout your important event over the next couple of days. Thank you so much. All the best. See you later.
Fantastic. Thank you, Jo. What an inspiring way to start the conference, and it really doesn't take very long before you learn something new, I find. So for me, the ecrogenic effect is definitely something that I will take away from Jo's speech. And I love the fact that she ended on a real high after talking about selfishness, greed and apathy, to talking about turning COVID-19 into a real focus for change going forwards. So without further ado, I'm going to move on to our next speakers, who will take the theme of COVID-19 forward to the next step. So we're going to look at trends and patterns in people getting outdoors during this period. So first up, we have Dr. Beth Brockett, who's a senior specialist in social science for Natural England. And then we have Aileen Armstrong, who is probably an advice officer for research at Scott Nature. So we're going to get to the national view now. We've looked outwards to the world and we're going to look inwards, and I think it's really helpful to look outwards first before looking inwards. And we're going to go to England and Scotland's view. And then afterwards we'll have a very short break between the two, and then we're going to go to Northern Ireland and the Republic of Ireland for views from there as well. So I'm going to leave you with Beth Brockett, but I will just say that we've got two people, Amy Greenwood and Catherine Burgess from Natural England, who will be answering questions on this in the chat channel. So don't be shy, put your questions in there as you think of them through Beth's speech. So thank you very much.
Hello everyone, thank you for inviting me to present at this conference. I'm sorry I can't be with you in person. So I am going to be I'm here to provide you with an overview of how coronavirus has impacted on our interactions and relationships with green and blue spaces and with nature more generally in England. What I'll present draws on Natural England's People and Nature survey, and you can see our user hub page scrolling away in the background, and I'll provide links and my contact details at the end. I'll also go into more detail about the findings in my second talk later in the conference. The People and Nature survey is a representative online survey of 25,000 adults living in England per year. You will see an overview of the methodology on this slide, and we started collecting data in April last year, and the findings I'll present here are from a mix of our Q1 analysis, so that was April to June last year, 2020, and our monthly indicator reports, which have been published from April to December so far, but they come out every month. And our Q2 data, July to September, is also published and available to everyone. And our next planned in-house analysis and report will be for the first full year of data collection, so that will be for April to April. I'll also report some headline findings from our August survey of 1,500 children aged between 8 to 15. And just to say that PANS, or People and Nature Survey, builds on 10 years of data collected by the Monitoring of Engagement with the Natural Environment, or MENE for short, survey, which surveyed nearly 500,000 respondents about how they experienced the natural environment in England, just because I'll reference MENE at points in this talk. So what did we find from the People and Nature Survey since April? So this spring, 40% of adults reported that they'd spent more time outside since coronavirus restrictions began, and this figure has remained constant into the winter. And we also found that 31% were exercising more in outdoor spaces. Again, these proportions remain constant into the winter. In the spring, 74% of adults took more time to notice and engage with everyday nature, things like listening to birdsong, noticing butterflies, that kind of thing. And we'll revisit whether this stayed constant over the full survey year in our first year report. However, this is a tale of two halves, and this spring 1 in 3 adults hadn't visited a natural space in the last 14 days, and 1 in 5 had not visited in the last month. Indeed, we found that the number of people visiting natural spaces this spring was overall lower than would be expected, considering the long-term trends identified by the MENE survey. So these figures of visits to nature have varied since April, as you'd expect, and as COVID movement restrictions have changed. So the number of people who haven't visited in the last fortnight did drop from a high of 46% in April to 20% in September. Then we saw a rise again to 27% in December. And I'll dig into some of the impacts on particular community groups and specific barriers in my later talk. So where in England have we been visiting nature? Ignore the small text. I just wanted to show you these 6 as a comparison. This is a subset of the types of green space and blue space we ask about. And you just need to know that weighted percentage of visits are on the vertical axis and months from April to December on the horizontal. And just to dig into it a bit more in detail, as before lockdown, urban green spaces remain very important. This graph is from the 10-year MENE survey headline report, so urban parks in green, playing fields in brown, showing the increasing proportion of visits taken to urban green spaces since 2009, and reaching a high of 46% of all visits to green and natural spaces in 2019. People and Nature has found a similar trend. In December, 50% of all visits taken to green and natural spaces were to urban green spaces. We know that we know that children feel happier when they spend time outside. Their parents and carers tell us so in the adult survey. We also know that having children in your household means you're more likely to be spending time in natural spaces. We wanted to ask the children themselves about their experiences, and very briefly, in August, 6 in 10 children reported they'd spent less time outdoors since the start of the pandemic, which is more than double the proportion who have spent more time outside. And when compared to the results for adults for the same period, we're finding that far fewer children are spending more time outside since COVID took hold than adults. So undoubtedly, children's mental health has suffered during this period, but the role of nature in supporting children's well-being is clear from the survey, with 8 in 10 children agreeing that being in nature made them very happy. And notably, children who reported spending more time outside and more time noticing nature were more likely to report that being in nature makes them very happy. So just to finish off by saying thank you for listening. It's very much a whistle-stop tour of the People and Nature survey findings. There's a lot more to discover on the hub, and I've just put up the contact details for the People and Nature survey team here. Thanks for listening.
Hello, I'm Aileen Armstrong from Nature Scot, and I'm going to spend a few minutes telling you about some of the headline findings from our COVID-19 research. In 2020, Nature Scot, in partnership with Paths for All, Cairngorms National Park Authority and Scottish Forestry, commissioned 2 separate waves of online research to help us understand people's outdoor visit behaviour and engagement with nature during the coronavirus crisis. Wave 1 was undertaken in June 2020 when we asked respondents to tell us about the period between late March and late May when the country was in lockdown, and Wave 2 was undertaken in September 2020, when we asked respondents to tell us about the previous 4 weeks, so mid-August to early September, by which time lockdown restrictions had been significantly eased. So, what did we find out? The headline finding was that at a population level, participation in regular outdoor visits was higher than the norm in both waves of research. And for our norm, we've used Scotland's People and Nature Survey data for the broadly equivalent periods in 2019. In Wave 1 of the research, the second bar in the chart, we saw a fairly polarised picture with an increased proportion of people taking regular outdoor visits and an increased proportion taking no visits at all. In Wave 2 of the research, the fourth bar, with the easing of lockdown restrictions, we saw a further increase in regular participation, while the proportion of people taking no visits at all almost halved to 10%. Nevertheless, participation in outdoor visits remained lower among some population groups, and we'll be taking a closer look at these later in the session. As well as asking people about how frequently they visited the outdoors, we also asked about the amount of time people were spending outdoors compared to the same period last year. In Wave 1 of the research, 42% of respondents told us they were spending less time outdoors than a year ago, but as lockdown restrictions eased, that proportion dropped to 24% in Wave 2 of the research. Over the same period, the proportion of people who reported spending more time outdoors compared to the previous year increased from 34 to 40%. In both waves of the research, those spending less time outdoors than usual were generally doing so because they were adhering to lockdown rules or because they felt anxious about the risk of infection. In Wave 1 of the research, those spending more time outdoors than usual were often doing so simply because they had more free time, for example because they'd been furloughed. In Wave 2 of the research, getting exercise and keeping physically fit were more likely to be mentioned as reasons for spending more time outdoors. Compared to 2019, we also saw a change in the amount of time people spent participating in different outdoor activities. The two columns on the right of this chart show the net change in each wave of research in participation in each type of outdoor activity compared to the previous year, with the greatest increases reported for short walks, wildlife watching, running and, in Wave 2, outdoor play. Compared to 2019, we also saw a change in the amount of time people spent visiting different types of outdoor places. The two columns on the right of this chart show the net change in each wave of the research in the amount of time spent in each type of place compared to the previous year. In Wave 1 of the research, when lockdown restrictions were in place, we saw net decreases in the amount of time being spent in many outdoor places, but increases for local places like parks, woodland and paths. In Wave 2 of the research, when restrictions had been eased, we saw larger increases in the use of local places. Many people recognised the benefits of time spent outdoors during the crisis, especially the positive impacts on their mental health and well-being. In Wave 2 of the research in late summer 2020, 70% of outdoor visitors agreed that their visits had helped them to relax and unwind, 60% reported an increase in their energy levels, and 56% reported improvements to their physical health. In addition, 58% agreed their visits helped them feel closer to nature. And we saw an increase in the proportion of outdoor visitors reporting each of these benefits between Waves 1 and 2 of the research. And finally, we asked people to tell us about their future intentions with regards to visiting the outdoors. We found that half of all respondents in both waves of the research expected to visit the outdoors for leisure, recreation or exercise more frequently once the crisis is over. Less than 10% of the population expected to visit less in future. So these are some of the main findings from our research, and later on we'll be looking in more detail at the impact of the crisis on different population groups. For more information about the research, check out the Measuring Participation page of the Nature Scot website. Thank you.
Great, thank you very much. And we apologise for the fact that that was really quiet. We got it. We put the volume up as loud as we could, and sadly that was as much as we could hear. But hopefully you got the gist from Aileen. We're now going to move on to two more short videos, one from Dr. Una May and one from Duncan Stewart. So Dr. May joins us from Sport Ireland, and Duncan Stewart is the managing partner at 56 Degrees Insight. And then I think, hopefully, you'll have got insight from all of the nations and the differences between them. So I'll let the last two videos play now.
Hi everybody, thank you very much for the opportunity to introduce this topic from Sport Ireland's point of view. I guess some people are aware of what we've been doing around the whole research on COVID-19, but it's great to have the opportunity to introduce everyone to the trends and patterns we've been seeing in getting people outdoors. Clearly at this time in this pandemic, outdoors is kind of the only activity anyway, so it's been a huge benefit to Sport Ireland and promoting the outdoors. I'm just going to touch very briefly on this, which is the background to where Sport Ireland sits on a policy level. We have our own statement of strategy for Sport Ireland, and we're also a key part of the Get Ireland Active, the National Physical Activity Plan for Ireland, which has reference to all levels of participation in sport and physical activity, including the outdoors. And all of this fits under the National Sports Policy, which has a very significant emphasis on participation and has plenty of reference to getting people outdoors as well. So this is a new focus for us, is to promote the whole area of sport and recreation in the outdoors. As it happens, as we've reached this situation with this pandemic, as I said already, people are more involved in the outdoors than they ever were. So it's been a good opportunity from that point of view. So we had, interestingly, as it happens, we were carrying out a normal research project, which we do every second year anyway, collecting information on people's levels of physical activity and sports participation in Ireland. And we were piloting some new questions around about February, March time last year. And coincidentally, this coincided with the start of the pandemic. So what we were collecting was information about lots of different aspects of sport and physical activity, but we've summarized some of the key findings. And one of the most, I suppose, successful elements and one of the most kind of heartening things from our point of view is this very difficult figure to shift, which is the shift in figures of people who are inactive. So participating in no form of physical activity at all in the previous 7 days. Now we prior to the restrictions last February, we had seen a tiny decrease in that number since the previous year's report. But what we saw is that over the course of the delay phase, which was, as we were all initially being told to be careful, and then the stay-at-home phase where we were totally locked down, and then round the autumn, the beginning of the autumn, where we had the roadmap for reopening of society and business. So what you see is a gradual decrease, but quite a strong, very significant decrease in the number of people who are inactive. And although when we started to reopen the country, the numbers went back up a little bit, they're still very significantly less than they were prior to, I suppose, last year, and also prior to the restrictions initially. So that's been really, really very powerful from our point of view, because that number is very difficult to shift. One of the key contributors to it has been a huge increase in recreational walking. So whereas we had quite good numbers of people walking regularly prior to the pandemic, so 66 in 2019, 65 at the beginning of 2020 before the pandemic struck. But as you can see, as we went through the phases of the pandemic, the numbers of people walking grew phenomenally. And although, again, as the country started to reopen, the numbers went down, they only went down a very small amount. So people maintained those habits, which is really powerful from our point of view. So not only were they walking when they had nothing else to do and nowhere to go, they maintained those levels of physical activity and those levels of walking during the early stages of the reopening of the country. Sport inevitably, sadly, took a more significant hit. Obviously, most organised sport closed down, facilities closed down, all indoor sport and recreation opportunities were closed down. So people lost those possibilities to take part in sport. We did see a slow increase again as we went through the stay-at-home phase, and our speculation there is that people slowly got organised and connected in with online sports and physical activity opportunities, including you know, buying themselves home training equipment and that sort of thing. So you can see that the overall trend is quite significant, but the most important one being the recreational walking. I'm sorry, I'm going a bit sort of long here, but just to say what we did find in terms of trends is that the social gradients, unfortunately, were maintained. So regardless of the success we saw in the levels of recreational walking across the board, we did see that the social gradients were retained, and that's something we want to look more closely at and try and establish, you know, why was this social gradient, why did that social gradient endure throughout the whole stage, and what were the main kind of, I suppose, influencers on that. As I said, we also had the issue of significant numbers of people taking up new activities, and that's been very promising for us. So although personal exercise, obviously a lot of people, you know, did engage with, you know, online opportunities and buying home equipment and stuff, what we saw was very interesting was the increase in hill walking. That clearly has been difficult in more recent times when we've been in more severe restrictions, but it's something we anticipate. So these are activities, and we've asked people, do they continue to maintain these activities? And a lot of people have demonstrated an intention to continue. So with those trends, we saw the increased usage of the outdoors. That has created problems for us, and I'm very familiar and very aware that this has created problems not just in Ireland, but across the board in the UK as well. And we've had a very significant increase in users in the outdoors, and an infrastructure which really hasn't been fit for purpose and hasn't been able to cater for those numbers. So we've had huge problems with overcrowding, parking and littering, and I suppose new people who are not familiar with the use of the outdoors and really not knowing and not being familiar with responsible use of the outdoors. So we've been running sort of, I suppose, cross kind of sectoral communications campaigns around littering and you know, safe use of the outdoors and that sort of thing. So we're taking those opportunities, but what we are seeing is that, you know, there's a recognition of the value that's been put on being in the outdoors. And I suppose as a very quick summary of what's next, we've seen that the government has recognised this and has started to invest significantly in greater levels of walking and cycling. And we're going to see that. We also have this, the 10 million which has been invested in outdoor recreation infrastructure scheme. So we're seeing a growth in the recognition of the value of being in the outdoors, not just because of the pandemic, but the levels of people's engagement with it and the opportunity that that's given us. So I'm very sorry that I went a little bit long and is a bit rushed, but thank you very much for the opportunity to share our, I suppose, our experiences and our knowledge we've gained. So thank you.
I'm now going to take you through some of the key results from the research we've been doing with the team at Outdoor Recreation Northern Ireland. The first phase of the project was a desk-based review of existing research relating to outdoor recreation. This included results from the Northern Ireland Continuous Household Survey and the Health Survey for Northern Ireland. For the second phase, we worked with ORN to design and launch a new survey of the Northern Ireland population. The survey used an online method with just over 2,000 interviews conducted during November and December last year. We've grouped the results of the research into these key themes relating to the Northern Ireland Programme for Government. So let's start with physical activity. During the period of our survey, physical health benefits were the most common reason for taking visits to the outdoors for leisure. In 63% of visits, the participant wanted to get some exercise, and in 49% of cases, health and exercise was a motivator. Overall, 73% of visits were taken for one or both of these reasons. By recording the activities people were doing on outdoor visits, the intensity of this activity and how long they were taking part for, we can estimate that 27% of the population met the Chief Medical Officer's physical activity guidelines through outdoor recreation. However, the benefits gained from outdoor recreation are not equal across the population. For example, this analysis of results from the Continuous Household Survey show how the percentage of people taking visits at least once a week was just 50% in the 10% most deprived parts of Northern Ireland, compared to 82% in the least deprived areas. Moving on to the benefits of outdoor recreation related to mental health and well-being. During 2020, reasons related to well-being such as seeking to relax and unwind, finding peace and quiet, revitalising or spending time with others were frequently provided reasons for taking visits to the outdoors. When it comes to the benefits that people gain from spending time outside, the results are even clearer. During November and December, 2/3 of those who took visits said it made them feel calm and relaxed, and a similar percentage felt refreshed and revitalised afterwards. Overall, 86% of people who had taken visits gained one or both of these benefits. And backing up these results, the Health Survey of Northern Ireland showed a clear correlation between how long someone took part in walking and their claimed levels of life satisfaction. The data also suggests that there are environmental benefits linked to outdoor recreation. Around 2 in 5 visits to the outdoors taken in Northern Ireland were motivated by desire to spend time in nature or to enjoy scenery and wildlife. And in around 1/3 of cases, people who had taken outdoor recreation visits reported feeling closer to nature because of this experience. Notably, this proportion was much higher when visit parties included young children, or when the visit was taken to certain types of place, including country parks and woodland. The 2017 Continuous Household Survey illustrated how those people in Northern Ireland who took visits most often were also most likely to feel concerned about the natural environment. Plus, there's an increasing body of evidence that proves that spending more time outside can lead to a stronger connection with nature, which in turn can drive up levels of concern for nature and the likelihood to take action and protect the environment. A further benefit of outdoor recreation is the potential economic benefits of this activity. There are many ways of quantifying this. Our survey looked at the amounts of money spent during outdoor recreation visits taken in November and December 2020. Across all of the visits taken, we found that an average of £4.40 was spent per visit. This doesn't sound like a great deal, but given the frequency of visit taking we recorded, we can use this figure to obtain a grossed up estimate of the total amount spent on all visits taken by the whole population during this period. And as you can see, it comes to a large amount, almost £100 million. And as shown in the pie chart, the spend was largely on fuel used on journeys and food and drink. Very likely the restrictions around coronavirus at the time the survey was done would have impacted on how people would be able to spend the money as well. Now, as we progress our analysis, we'll look to refine this estimate, and it could be valuable in future to inform economic impact type analysis of the sector. Now, outdoor recreation can also play a role in helping to tackle inequality, but our survey results have shown how currently the opportunities to participate aren't always equal for everyone in Northern Ireland. Firstly, we can see how during November and December last year, the coronavirus pandemic meant that many people changed the amount of time they spent outdoors, with some increasing their time but others spending less time outside. However, these changes varied within demographic groups. Members of the most affluent socioeconomic groups, people in full-time employment, younger age groups and people with a car were the most likely to increase their time outdoors. However, disabled people, women, people aged over 65 and residents in the most deprived areas were the most likely to reduce the amount of time they spent outside. We also see some inequalities in the provision of green spaces, paths and trails across Northern Ireland. For example, as shown here, paths and trails tend to be less accessible for people with disabilities, for residents of rural areas and for women. And finally from me, the results from our survey and other studies we reviewed can help us to plan for the post-COVID recovery. We've seen how during this period, while some people have spent more time outdoors, many more have reduced their time outside, and that certain population groups have been more negatively impacted, unfortunately. A survey conducted by ORN during the first lockdown pointed at the types of things we need to do to improve opportunities for local outdoor leisure. As you can see, whilst the most common feedback related to dealing with dogs and dog mess, nearly all of the other comments related to improving access by opening up more dedicated trails for walking and cycling, more green spaces, and improving access rights. These results provide some really clear pointers towards what needs to be done next. Okay, so that's all from me. Thank you very much for your time.
Great, thank you very much, everybody. A quick reminder, please do ask questions in the chat channel, and please do give us a thumbs up if you're able and willing to join us for the lunchtime session. So it gives me great pleasure to welcome live now Dr. Una May, Head of Ethics and Participation at Sport Ireland. Una again is going to be available for questions in our live Q&A session later, as are three of our other next speakers. So Una's going to talk to us about movement as prevention. How do we get more people moving more often? So it gives me great pleasure to hand over to you, Una.
Just to say that a bit of background, as I've mentioned this morning, the background is where Sport Ireland sits in relation to the National Sports Policy and the National Physical Activity Plan, so I won't linger on that. During the last 12 months, we also launched a sport and physical activity in the outdoors policy for Ireland. And we were looking at the challenge, which is the challenge posed to us today, which is how do we get people more active, specifically more active in the outdoors. And we've identified 4 target areas for Sport Ireland to focus on around leadership, building capacity, supporting infrastructure development, and probably most relevant to ourselves is the creating opportunities. And that's really what I'm going to focus a little bit on for the next few minutes. So obviously providing leadership, Sport Ireland is the state agency responsible for the development of sport and physical activity, and we've been very active, and I'll come to a slide later to demonstrate some of the activities during the recent pandemic. But what's been very interesting to us is that our government identified the work we're doing in the outdoors as being key, and in the most recent extension of our winter lockdown this year, the only reference to sport was that sport was not going ahead, but Sport Ireland would continue its work in promoting the outdoors. So that's very important for us to demonstrate that we're getting into the right space when it comes to leadership. In terms of building capacity, we do a lot of work around training. We run training programs for the development, design, management, maintenance of trails, etc. And that also aligns with the supporting the infrastructure development around building capacity. We also provide training around access to the outdoors. So in relation to the creating opportunities, we've been looking, and it's aligns a little bit, and I expect that Trudy will mention this in due course, is the idea of understanding better who it is we're trying to provide opportunities for. So as we've seen in the number of presentations already, there is as Joe put it, an echogenic effect. So what we want to do is identify the target groups we're working with and figure out greater insights into those groups and what it is will take us to get those groups more active. So people in disadvantaged communities are a target for us, and we've been working in this area for quite some time. And in creating opportunities, we've established a new urban outdoor adventure initiative. And recognising that not everybody has a car and can get to the countryside, we're trying to provide opportunities for at-risk youth groups, disadvantaged school groups, including also people with disabilities. We also have a community sports hub model, which is a collective of sports clubs and local organisations who might come together to provide opportunities for people in local communities. And we've developed a number of different models of community sports hubs, including based around a school, based around community centres, and one of them is based around an outdoor environment, though they have been particularly successful. Moving on then in the creating opportunities, last year we launched a guide for accessibility to the great outdoors for people with disabilities. So this is targeting the people, the organisations, the state agencies, the equivalent of the Forestry Commission, who are responsible for the development and I suppose infrastructure actual building, which is not something that we're responsible for, but what we provided is this guide to assist those who are designing and developing infrastructure to ensure that there's access for people with disabilities. We're also currently working on a very big project, which is a national base registry of all sport and recreation facilities and amenities in Ireland. And the idea of this is that we'll be able to provide information to people on where to be active. And that's something that we've realised, and I mentioned it briefly this morning, was the overcrowding and I suppose the inability of our existing infrastructure to cope with the large numbers of people getting active. And what we want to do is be able to ensure that people can find opportunities outside of the normal regularly visited locations that are close to urban developments. From a programming point of view, we work with national governing bodies and local sports partnerships, and we've been developing a number of different initiatives, not just through the pandemic, but in general around getting opportunities for people to be active outdoors. So an example, I suppose, in the local sports partnerships would be outdoor dance programs, Women on Wheels, which is a cycling program, Woodlands for Health, which is a program working with our forestry experts and our health services executive for people with mental health issues, triathlon, Sofa to Saddle, and other. So loads of different, I suppose, sports specific initiatives. But then through the national governing bodies, we have the more sports specific ones. So the Liffey Descent is a huge participation event down the river that joins the sea in Dublin. We had the Water Sports Inclusion Games, which had, I think, 200 to 300 participants from people with disabilities and their families, with giving them the opportunity to take part in water sports with their families, which has been a really important part. So families have the opportunity to do things together rather than bringing people with disabilities separately and treating them in any different way. I suppose just some of our responses to COVID, and just relating back then, as you see in the middle, the campaign we've had around promoting activity and physical activity in the outdoors. That whole campaign was really called #Outdoors for Everyone, and was a cross-sectoral, cross-departmental, cross-agency project. We had 30+ agencies come together to discuss and agree the main issues and the main messages we needed to communicate to people to be active in the outdoors. Obviously, you know, we're not just talking about the outdoors with this topic. So we carry out a lot of programs. As I said, we're looking at focusing on specific target groups. So older adult exercise programs, the one in the middle, No More Excuses, was a campaign targeting specifically men over 45 in disadvantaged communities. So we did a lot of work on the insights into what it would take to convince them to be more active. We've developed apps to try and, so we developed an initiative to try and get people active, to provide them with somewhere to go. And I think it was mentioned before, I think it was Joe who mentioned about access to parks and green spaces. So what we've been doing is working on a plan. It's been a little bit hampered by the latest restrictions, but that big local sports facilities would be open to the public to go walking within them. So rather than the public having to raid the local golf course, they were able to access clubs and, or sorry, the plan is that they will be able to access, when the restrictions are eased, club facilities to walk around those facilities. Keep Well down in the left is as a national winter resilience campaign to keep people, encourage people to be active. Sorry, that is one of the 5 pillars of the Keep Well campaign, is being active. And the Department of Health have funded TV adverts promoting sport and physical activity and encouraging people to go to the Sport Ireland website. So it's been a very busy but very successful winter campaign, and has raised the awareness to what we're doing in Sport Ireland, and particularly the awareness of the outdoors work. So I suppose going on again in terms of what we need to do to keep the people who we've managed to successfully get out into the outdoors now in the pandemic, and how do we keep them there? So again, further work researching barriers for specific target groups. So we're due to do work on women over 40 this year. We're currently doing work on all areas of diversity and inclusion, so looking at minority ethnic groups, numbers of different groups who maybe have specific needs and specific barriers for themselves. We'll continue with the Outdoors for Everyone campaign, working with our partners across the sectors, and make sure that the outdoors remains on the government agenda, so that when the likes of the restrictions that have been eased, that are currently there, when they start to ease those restrictions, that it's very clear that there is a support for people being active in the outdoors. And I mentioned in my morning's presentation the investment by the government already in improved cycling and walking infrastructure. And that's something that we've seen a huge increase in the last year with the new government, and a new programme for government has really identified that as a key target. And we continue to work in the area of coordination of stakeholders, and I think that's identified across the board, and it was identified by Joe there from the conference in 2017, where it was pointed out that one of the big roles that have to be played is the area of collaboration and working together, and that's something we see as an important role for us. So I'm sorry I had to rush, having messed up at the beginning, but if anyone has any questions, I'm happy to share them or discuss. I think it's later after we finish Trudy's session. Thank you.
Wonderful, thanks Una. And it's always stressful, isn't it? There's always somebody who happens to be on mute with any Teams meeting. So thank you, and a brilliant recovery. I'm now going to share a pre-record from Trudy Els, and Trudy is the strategic lead at Sport England for facilities and planning. A lot of you will know Trudy's work in our sector and in our environment across England, and she certainly for Sport England takes a lead at looking at how we can get people moving. So she is going to talk about the 10-year vision for Sport England to transform lives and communities through sport and physical activity. And so I will hand to her.
Hi, I'm Trudy from Sport England, and I have the privilege of taking you through Uniting the Movement, which is our strategy refresh and outlines our 10-year vision.
Over the last year, sport has taken a hit. Across the land, movement has been restricted, and the challenges we already faced grew bigger. Today, the need to tackle them is more urgent than ever. We believe that when we move, we are stronger. And that sport and physical activity can do so much more. Play a role in society like never before. From pitches to pavements, we'll come together again. Uniting to meet the challenges and make a difference. It's time to take it to another level. Because movement is essential for our health, for our communities, and for the next generation. Let's give sport and physical activity a bigger role and bigger goals. We'll get more people moving, playing, feeling the effects. More feet walking, more hearts beating, more celebrating. Individual inspiration, community connection, national transformation. When we work together, we can make a meaningful change. That's our strategy. And united, we can make this happen. Because today, we all have a bigger part to play. United, we are the movement. Join in and visit unitingthemovement.org.
Wow, doesn't that video make you want to go and be active? I hope everyone can return to activity from the 29th of March with some friends outdoors. I certainly will be. Uniting the Movement is Sport England's refreshed strategy. It's not a new strategy. It builds on our previous work, of which many of you were party to. And thank you very much for everybody who fed into our strategy, because we built it with you, and hopefully it's a reflection on your feedback back to Sport England about how we can increase activity levels across the nation. This strategy isn't just about helping more people play traditional sport, it's about extending that offer to enable lots of people, those who currently don't, lead an active lifestyle. And we positively believe that if we can encourage more people to be active, it will have a greater benefit on society and promote everyday living. Moving really matters. It matters because it saves the economy and society billions of pounds. With people leading active lifestyles, we can reduce GP visits. That in itself saves 30 million GP visits a year. If we invest in physical activity and sport, just £1 generates £4 benefit to society. We also know there's huge individual benefits as well. It can offset dementia and type 2 diabetes, so there's benefits all round. Physical activity, sport, movement also makes individuals more resilient. So by playing sport, we're getting stronger, and that strength enables us to be much more resilient and play a stronger focus and impact in our local community, and we've got better chances in education and employment. So we definitely need more people to move more to realise much more benefits. But we have to make sure that everybody has an equal chance to move more, and we therefore need to tackle some of the inequalities that currently persist. Sport England are going to deliver their strategy by doing three things. The first, the important role of advocating for physical activity, sport and movement. The second, by joining forces on the big issues. And thirdly, by creating catalysts for change. The big issues which we can see in front of us being recover and reinvent, connecting communities, positive experiences for children and young people, connecting with health and active environments have all been developed in association with your feedback. These are the big themes that came through in the consultation, and it's where we perceive there to be big barriers to stop people accessing and offer to be physically active. It's also where we need to put our emphasis to try and reinvent or recover, be innovative across all these big issues to ensure that we can promote inclusive and new exciting activity offers to allow everybody to enjoy physical activity. Let's start our deep dive into the 5 big issues with Recover and Reinvent. It's very timely with the 29th of March looming for many of you, when you'll be opening up more sites to more people. Recover and Reinvent is all about responding to COVID-19 in the short, medium and long term. It's about supporting organisations and people in their return to activity and to build a stronger, more relevant and more inclusive offer. We want to work with partners to help them design and deliver enjoyable and inclusive offers, and that means being agile and innovative by using data and digital opportunities. Sport England do have insight and data available, and we'll run through some right at the end of the presentation, but it's really important to recognise the inequalities that exist in the access to physical activity and sport. This is where we're going to place our emphasis to ensure that it is a level playing field and allows everybody the opportunity to participate. Those that experience less activity include women, people from lower socio-economic groups, older adults or 55 plus, those with disabilities and long-term health conditions, and Black and Asian adults. It's our mission to make sure inequalities are tackled. We want to help more communities enjoy the benefits of physical activity by connecting communities. This is where we'll help them to realise the benefits of physical activity by a bottom-up approach, consulting with the local neighbourhood, with the communities as they know best. We won't do it to them, but we'll do it with them. We want to use physical activity to connect to the wider agendas within the locality as well. This is where it's called or considered a system-based approach to enhancing quality of life by use of physical activity. Advocating the benefits of physical activity will need to play a strong role in connecting communities. We'll look to extend our place-based work across more places and to work with more local decision makers to ensure that more communities have access to physical activity and build stronger, resilient places to live. I know for many of you that creating positive experiences for children and young people sit at the heart of your organisations, and it does at Sport England too. We know that by creating positive experiences with physical activity at a young age helps children lead happier and fuller lives. We need to build these foundations for life because it contributes to our physical literacy. Over half of children are not active enough. Therefore, we need to make sure that our physical activity offers are relevant to them, especially post-COVID. That may mean a transfer to the outdoors rather than indoor sports initially, because it reduces some of that anxiety and worry of the parents of the children mixing. We know that there's inequalities again in the rate of uptake of physical activity and sport for children. Those that are less active are from poorer areas, Black and Asian backgrounds, and girls and young ladies. Therefore, we need to make some positive changes, and we can do that by the use of technology, by enhancing safeguarding, by working with other professionals who work in mental health to help them use physical activity appropriately and devise new offers for them. And it's also about enjoyable experiences. And it's not always about traditional sport, it's about recreation, about movement, and that's where the outdoors can be of real benefit in this area, and we really hope to work with you on this too. Over the next 10 years, we'll be looking at how to connect physical activity and health and well-being. We know it has such a positive impact on both the individual and the healthcare system. However, we also know that 40% of the working population will probably develop long-term health conditions, and we also have an ageing population. These two factors alone indicate to us that people will be less active. The two cohabit. Therefore, we have to make sure that all our offers are aligned and promoted to the right audiences and to ensure they're easily accessible. Health is quite trendy at the moment. Many of us have the iPhone watch or gadgets, and that helps us track our number of steps, perhaps our heart rates and our stress levels. So if we can empower people to understand their physical health linked to physical activity, that is advocating for an active lifestyle. We also have the opportunity to work with the healthcare system to make sure that we work with the professionals and advocate correctly the use of physical activity. There's the famous statement that's saying if only physical activity was a pill, it would help so many more of the population. We have to work and enhance that type of offer, and we're doing so already. We've got some trials with some of you actually ongoing at the moment through Social Green's Prescribing or Community Health Works. It's offers like that we need to work up in tandem with the healthcare system. There's lots of opportunity in that space too. So we look forward to working with you on that area. Active environments is all about creating and protecting the spaces around us to enable people to be physically active. It sounds really simple in principle, but actually quite hard to do. We want to do this in 4 different ways. We'll look to protect and improve the current leisure provision. This can include local leisure centres as well as other built facilities, and it's working with the providers to ensure that the offers are fully inclusive, they're accessible, and also they're modernised. We also have to consider the element of recover and reinvent as well for some of our major facilities. Facilities in community areas as well are vitally important. This isn't just sports clubs, but can extend across to community halls, church halls, parks, open spaces, trails. They all need to make sure that they are fully accessible as well and connected into communities. There's no point having a fantastic playground 5 miles away from the local neighbourhood without any signage, without any walkways or any ability of getting there. Therefore, we have to look at active environments as the package and the neighbourhood in order to allow people to access all the facility provision. It's about creating better places to live. So looking at that neighbourhood again, creating 20-minute neighbourhoods to allow people to connect themselves across the cities by walking and taking active travel. And we also have to have an eye for positive climate change as well, to make sure that we're not impacting the environment. There's lots of different things that we can do to help climate change, not only by active travel, but also by design and built innovation. Hopefully we can create some appealing places to allow an inclusive offer. Now, for many of you, you've got access to open outdoor spaces, perhaps wildlife trusts, walking trails. Let's have a little think how we can make those fully accessible to create that enticing active environment. Where's the car park? Where's the trail headboard? What's the type of terrain underfoot? Where's the information to the user so they know whether that trail is accessible to them or suitable for them? Make sure there's a lot of pre-information as well so that consumers can make the right choice. There's lots of tools and design tactics available on the Sport England website, and we'll be looking to expand that across a number of settings to fully create these active environments. So hopefully now you have a flavour of the big 5 issues. Shall I test you? Perhaps not today, but very happy to pick up any of the big issues in partner conversations or at further workshops. Please also feel free to contact us if you'd like further information or to work through any of them. At Sport England, we'll be using catalysts for change to help deliver our strategy, which include effective investment, investing in people and leadership, innovation and digital, data insight and learning, and also good governance. Hopefully that's given you a flavour of our 5 big issues contained within our strategy refresh. Sport England will look to deliver them by using catalysts of change, which include effective investment, new models for investment, people in leadership, innovation and digital, data insight and learning, and of course good governance. For the last few minutes, I'd like to focus in on some data and insights from the COVID pandemic. This might help you build back your offers to encourage people back to physical activity. There's some important themes that run through that probably need to be incorporated as part of your opening back up. We can see here that inactivity rose during the pandemic, so 7.4% of the active population became more inactive, therefore they weren't doing as much activity. We also know that as last year during the lockdown, when we were just coming out, activity fell even more. So it wasn't that as we were opening up, activity just bounced back. That should give us an indication that this year could be the same, although there are some prominent sports. in there. For children, again, activities levels fell by 2.3%. There's a difference in here between boys and girls. Boys are actually more affected than girls because they traditionally play team sports, football and rugby. However, for girls, although their activity levels are generally lower than boys, in the pandemic they found other ways to be active, and actually doing activity in an informal setting with families suited them more so than boys. So there are some positives to take out of the COVID pandemic, but we must remember what they are as we build back our offers. Pre-pandemic, we know that 6 major activities make up the majority of adult physical activity, being walking, fitness, cycling, running, swimming and football. We lost the opportunity to do some of those during the pandemic, and therefore the biggest gains were across walking, cycling and outdoor fitness. Some of those trends will continue with us in the recovery phases of COVID, and walking and outdoor fitness will remain especially important for women, those over 55 and those from ethnic backgrounds, as they tend to be the main activity that those audiences undertake. Hopefully this slide may give you some insight and support to redesign some of your offers post-COVID during the lifting of restrictions. We know that some people are going to return to different activities at different speeds. They'll be weighing up the safety, accessibility and availability of the offers. We also know that many won't want to return at all. Worryingly, that sits around 12% at the moment across activities, but it is higher for the indoor team sports. There's a couple of themes that are influencing our decisions, being financial, levels of anxiety and also caring duties. People are indicating as well that the outdoors may be a really relevant setting for them to return to sport, especially for those of the older age group or with long-term health conditions and disabilities. They're feeling it may be safer. Interestingly, they're also looking forward to mass participation events returning, so that's really good as well. That may have something to do with the social interaction if they've had lots of isolation over the last 12 months. And unfortunately, we will continue to see persistent inequalities in the uptake of activity across certain target groups. We also know that the 16 to 34 age group will be particularly affected due to the financial impact. As we transition between our strategies and also come out of lockdown, we continue to campaign. Join the Movement is currently running, where we're trying to engage with people at home to continue being physically active. We Are Undefeatable is coming back to social media as well as TV, and that inspires and supports those with long-term health conditions to engage in sport and physical activity. And our flagship This Girl Can campaign will return as well across our media platforms. We encourage you all to sign up to the supporters page, where you can get the most up-to-date and relevant material to push out to all your consumers. Thank you for listening to the workshop. I hope it's been useful and that we've inspired you to consider the role of physical activity and sport in your day-to-day operations. I'll leave you with the current funding that is available through our Return to Play programme, where we cover grants for community assets, small grants and Active Together. And please feel free to contact myself if you have any questions from the presentation. Stand up, do a couple of steps and go and make a lovely cup of tea. Take care everyone, see you soon.
Brilliant. Okay, so we're just a little bit ahead of being able to have a good old leg stretch. That will come at 12 o'clock. So a really thorough and interesting presentation there from Trudy, and I know that Trudy will be very, very happy to answer questions after this. So without further ado, again, I'm going to move on now to movement as medicine, where we're going to look at the green prescribing, social prescribing side of getting people active. And I'm really pleased that we've got Bridget Finton, who is Policy and Advice Officer in the People and Places team at Nature Scott. And we also have Dave Bell, who is the Principal Advisor for Health and Wellbeing and the Environment at Natural England, along with Helen Holmes from DEFRA. So we've got 3 actual live people now, and we're going to start with Bridget. So over to you.
Many thanks, Bridget. That's very kind of you. Morning, everybody. And just for anybody that perhaps missed it, we are still legally Scottish Natural Heritage. But last August we rebranded to Nature Scot. So yeah, yeah, it's good to be able to share what's been happening in terms of the development of partnership working between health and environment and other sectors over recent years in Scotland. And as you can see, it was nice to get a shout out from Jo Hopkins earlier, and I've stolen her title. She's used it in a number of conferences and presentations. Next slide, please. So I'm going to introduce by kind of explaining what's been happening over the last few years. In 2016, SNH, as we were then, with encouragement from Scottish Government, including the then Deputy Chief Medical Officer, who is still happily involved in this initiative, and also with support from key partners, we came up with an initiative called our Natural Health Service to realise the potential of nature-based solutions for health improvement. It's a broad programme, and as you can see here, it's about connecting people and nature, linking with other sectors and demonstrating the benefits, and it's being achieved by working in cross-sectoral partnerships with a strong focus on tackling health inequalities and getting more people into the outdoors. Physical activity and contact with nature is something that most of our organisations have been doing for a long time, and we have a good track record of establishing partnerships. Next slide, please. I should say SNH led on the development of this, but yes, we have a really good group of partner organisations that are working with us. So this diagram is what we use to describe the broad concept of our natural health service. So at the bottom there, the natural environment, crucially, is the resource that enables what we call 3 pillars of green health activities, with pillars 2 and 3, nature-based health promotion initiatives and nature-based health interventions being most important for underrepresented groups that need most support. Next slide, please. So in terms of how our natural health service is being implemented on the ground, green health partnerships have been established to demonstrate the approach of our natural health service. These are multi-sector collaborations led by area health boards and local authorities as crucial local partners. They're responding to local health and social care policies, plans and priorities. They all have, the 4 that we have at the moment, they all have a dedicated project officer who's coordinating the delivery of a plan that's been agreed by the wide range of local partners and stakeholders that come from across the public and voluntary and community sectors. Green health partnerships have a main aim of upscaling and mainstreaming green health. This is the phrase that we're generally using in Scotland. Mainstreaming green health into healthcare policy and practice. And to do this, green health partnerships are undertaking various activities such as the promotion of the benefits of green health to the public, building confidence and capacity about the usefulness of green health to a very, very wide range of healthcare staff, and with and through partners around the table at each of these local green health partnerships, There is development of green health projects, whether that's expanding existing or coming up with new green health projects to expand the offer. And the green health partnerships have been very successful in securing a range of external funding to get some of these projects expanded or developed, or new ones developed. And also, crucially, and the topic of this presentation, green health partnerships have also been working in their various ways and slightly different approaches, but working to develop referral pathways, connect people from health and social care practitioners to green health projects. As you see there, we have 4 green health partnerships operating at the moment. Next slide, please. And they are all in their 3rd year of operation, having started in 2018. So, green prescriptions, an aspect for, I'm sure most people have a feel for what this is all about, but an aspect of broader social prescribing, which is all about linking people to non-medicalised groups and services in their local area. So I'm going to just give you a feel for 3 examples that are coming out of our green health partnerships. Briefly, these 2. Lanarkshire is an example of an approach where they've decided to try and integrate prescribing of green health activities into existing referral pathways. So there was an early task for all green health partnerships to undertake an audit of local green health opportunities. So a green health directory was developed for Lanarkshire. You can see the URL on the screen. And they a range of projects were, the information about a range of projects was incorporated into existing databases of local services which health and care practitioners use to then be able to refer people to. There was also lots of effort devoted in terms of the Green Health Partnership project manager and other partners to raise awareness and build confidence within the health sector about the use of green prescribing. I am beginning to run out of time, so I'm going to skip North Ayrshire. Next slide, please. The next example is the most developed green prescribing system that I've come across, and it's coming out of the Dundee Green Health Partnership. That having done that initial audit of all of the green health opportunities throughout the local authority area, 11 green health projects were identified, green prescription pads were developed, and there's an image there with a funny telephone. And the telephone is relevant because one of the Green Health Partnership partners, called Dundee Volunteer and Voluntary Action, recruited a member of staff who receives a portion of the prescription so that they then provide a follow-up service to referees and advise them on what activity might be appropriate, and then they can provide support services, even organising a volunteer to provide a buddy for a first attendance, for example. So this system, this bespoke green prescribing system, was initially piloted in 3 GP practices in Dundee and deprived areas. That was then expanded to 16 practices. And then COVID kind of put a halt on proceedings, but their plan is that the system will roll out to all 22 GP practices throughout Dundee. So far, there are over 300 prescribers across primary and secondary care. The prescription has also been made available in a digital form because clearly health practitioners are not seeing not having face-to-face consultations very much at the moment. And the last data that I saw, DVBA had achieved follow-up consultations with 35% of people who had been issued with a prescription. Next slide, please. To accompany the system, lots of promotional activity has gone on, including adverts on Sky TV channels. And also you can see there a very recent addition to the materials, a calendar providing ideas for things to do locally. The Green Health Partnership and aspects of its work have been very successful in winning awards, including a very recent one in terms of Best Nape-Based Social Prescribing Project. Next slide, please. So just to wrap up, the first point, I think, just can be taken as read. And in terms of green prescribing, my experience is that all area health boards are different, and there are often numerous referral pathways, for example, from GP practices, clinical teams, lifestyle services. So there's no standard model throughout the country, and we as advisors shouldn't try to be prescriptive about how to establish green prescribing. If it's possible to integrate green health options into existing prescription systems and processes, then that's great. And these could include specific social prescribing schemes that operate as intermediary agents in some places. But depending on local or regional circumstances, a specific profile and bespoke system of green health prescriptions may well be more appropriate. The vital ingredient is easy access to information about the availability of green health options in a local area that people can be referred to. We should also recognise that formal prescribing is great, but less formal signposting and targeted promotion of green health activities or initiatives by healthcare and support staff can also be effective in influencing healthy behaviours. Within the Our Natural Health Service programme, Green Health Partnerships are providing context and wider support in terms of establishing green prescribing within their areas. And that kind of wider support includes running public-facing communications campaigns, engaging with healthcare staff to build capacity, networking with green health delivery partners, and also incorporating green health into plans, policies, and strategies to aid mainstreaming. And lastly, just very, very recently, actually from a meeting 3 weeks ago, which was chaired by our Minister for Public Health and attended by our Chief Medical Officer and senior staff from key public sector organisations. The meeting very recently resulted in commitment from 6 national partners, including Nature Scott, to fund a further phase of green health partnerships, which should enable 2 more years of funding for the original green health partnerships and also support for the establishment of 3 new ones. There are various web links there, and thank you for listening.
Thank you, Bridget. And good news on the funding there right at the end. Brilliant. Okay, next up we have Dave Bell. As I said, he's from Natural England, and we have Helen Holmes, who's Health and Wellbeing in Nature Leader for DEFRA. So over to you both. Thank you.
Hi everybody, I'm just going to attempt to share my screen. Can you see that?
Yes, we've got that, yeah.
Great, okay. Okay, so hi everybody. My name is Helen Holmes and I'm joined by Dave Bell today. I'm just going to be kind of talking you through the Preventing and Tackling Mental Ill Health Through Green Social Prescribing cross-governmental project, giving you a bit of an overview of what the project is all about, and then Dave will take you through some more kind of details and kind of up-to-date latest on what's happening on the project. So the first slide is about what is green social prescribing. So I'm sure you all know this, so I won't spend too long on it, but we are using green social prescribing to refer to both green and blue environments. So it's covering a huge range of different kinds of activities and kinds of spaces. So it could be green exercise, walking for health schemes, dementia walks, local park runs, care farming, community gardening, food growing projects and so on. And what we've seen already in the project is the massive range of activities that different areas do already provide, and the potential for new types of activities to be brought into the kind of umbrella of green social prescribing. So the aim of this project is on the screen there. Obviously with COVID-19, we know that this is more important than ever. And we're trying to convene individuals from across the system to innovate, create and begin to implement sustainable outcomes and policy solutions, which will help to make a step change across the whole system. This project aims to explore how green social prescribing can be embedded into local social prescribing schemes and mental health services. And the overall aim of this is to try and improve mental health and well-being, reduce health inequalities, reduce the demand on the health and social care system, maximise use of green space and improve access to green space for everybody, and understand how providers of green social prescribing activities can become more resilient and expand. Obviously this project isn't happening in isolation, and we know that it links into a lot of wider government aims and priorities. So obviously there's a 25-year environment plan, DHSE's prevention green paper, a wider cross-government commitment to transform mental health services, the work of the National Academy of Social Prescribing, and obviously it's on everyone's minds at the moment how we recover and rebuild as the pandemic, fingers crossed, starts to come to an end. So what is the project going to actually do? So the project is split into three separate work streams. The first work stream is the local system test and learn sites. So these are going to be in a variety of locations across England. We have actually decided where they are, and Dave's going to take you through that a little bit later on. NHS England are leading on this work stream, and the idea of it is to establish the support and resource required to scale up green social prescribing in the locality and implement interventions to increase referrals to nature-based activities. We've chosen sites which have been particularly impacted by COVID-19 in one way or another, but they are quite varied, both in terms of where they are and the types of areas that they're in. So we're hoping that it will really provide a bit of a deep dive into what's needed in local systems that can then be applied to other areas across the country. There's also the national experimental work strand of the project, and this is being led by DHSC. We're kind of working through at the moment what that's going to look like on the ground, but the idea behind it is if the 7 test and learn sites are kind of a deep dive, this is looking more nationally to understand what's needed to be able to scale up green social prescribing across the country. And lastly, we've got the ongoing evaluation, and this is led by DEFRA. So obviously we want to do all the good work of the project, but we also want to learn from it and get something out at the end which can help to inform future policy decisions. So we're looking to evaluate the project. The contract for that will hopefully be awarded in the next couple of weeks. And these are the outcomes that we're aiming to achieve. So we want to be able to scale it up in practical terms, but we also want to understand why this can't always be done and what the blockers are, and obviously the ultimate aim of that is to provide recommendations and next steps and costs. We don't want this project to just take place and, you know, that was great while it lasted, but ultimately there's no kind of long-lasting impact. We want to make sure that this really makes a difference. So in terms of how this project will be delivered, it's fairly unusual for a government project in that it really is across a lot of different government departments and other organisations, so Natural England, Public Health England, NHS England. And so I've already spoken about the individual leads of each work stream, but we've got a lot of other partners that are helping us with the project as well. Sport England, Ministry of Housing, Communities and Local Government, Yeah, quite a few really. And the kind of way we're trying to work is make sure that it's truly cross-cutting. We're not just kind of consulting people now and again. We want everybody to be fully bought into how the project's delivered. And that goes for the local system representatives as well. So at the moment, the test and learn sites are sort of just getting going, but we're really keen that we engage with them, and it's not a kind of top-down national approach, that it's something that's really cross-cutting. So that's a bit of a whistle-stop tour through the project. I'll hand over to Dave now to take you through a bit more on the test and learn sites.
Thanks, Helen, and hi everybody. Thanks for inviting us today. So yeah, this is I'm not sure, the screen's slightly small, but this is a bit of a map of where the actual sites are themselves. So as you can see, there's a bit of a band around sort of the Midlands flowing into Yorkshire, and then one around Surrey and one around Bristol. So these are the pilots that are currently working with us and across government to develop their proposals, and which will be sort of starting to launch in the next few weeks. So they were announced in December, and we're in a co-design phase at the moment, looking at further developing their plans. So you may start seeing things locally in these areas over the next few weeks and months, around more detail on their plans. We go to the next slide, Helen. And because, as Helen's already said, a key focus on this is how the green social prescribing works at a system level. And I think there's so much great stuff going on out there. So many of you will be aware of activities going on in your areas, as well as potentially longer standing sort of national programmes that are delivering this space. But as with all sort of developing systems, it can look like a bit of a mess in places. So what we're hoping these pilots will start to do is to pull out those strands and look at how it works at a system level. I think, just so you're aware, the diagram on the left is a diagram from NHS around their social prescribing link workers. So there's a commitment to have 1,000 new social prescribing link workers in place by the end of this financial year, and I know that they're very close to hitting that. But obviously those people have got masses to think about, and there's a real focus on individual personalised care. So where does green prescribing fit in there, and how do those link workers have easy access to provision in their area and understand the provision and the options available to them in their area? And then the picture on the right, there was one, so I used to be based in one of our local teams in Natural England. So this was from the Lancashire Wildlife Trust's MySpace programme, which looked at pathways. And what we want to do in this project is join up those two sectors, both in terms of the approaches, the pathways, skills, perspectives, and even language. As we're finding, as a cross-government group already, we're sometimes making references to things where it can be easily misunderstood or assumptions can be made. So that's a key learning as we work across government on this. On the next slide, I thought I'll pick out a few bits of colour, maybe a bit of innovation that's going on across some of the pilots. How do we use technology to help us understand and track and monitor the impact of green prescribing and our connection with nature? So there's some of the projects have started to look at some of those as a potential area, and how we can use simple things like mobile phone apps or Fitbit type technology on your wrist to map mood when you're in green spaces. Another one, looking at the idea of a green kit library to help people engage with nature, so giving people the tools locally in their area to start engaging in the information, in a nice packaged box. The biggest thing I've sort of been learned in the past 2-3 months I've been working on the project is that focus on community and helping build local and long-standing partnerships. And you'll notice that the previous talk from Sport England, who are a partner in this project, was also talking about that community voice, community engagement as being key. And I've had much more varied discussions across government and with sort of local groups than I've had ever before, sort of in my time in Natural England since working on this project. And that's a great thing, in terms of how we connect more people with nature, and help more people to benefit from the impact that nature and connection to nature can have. And finally, I think there's a big opportunity now, we've touched on it sort of slightly, around a green recovery from COVID. What does that mean? How can we support that? And I think the strong pathways that green social prescribing can provide in terms of skills and employment, and look at how can groups that are potentially underrepresented in things like recovery work can actually be sort of the leaders in the green recovery in terms of what skills are needed, and how that can help us drive locally driven community approaches to a green recovery from COVID. So there's a few things going on. There will be more information on the pilots and the summary of some of their goals and approaches in the next few weeks and months coming out. So I think on the next slide there's a few links to key contacts and the Test and Learn site contact details that are on there as well. I will be regularly updating that as a group. That's the end of my part, and if you had any closing remarks, Helen, or if we'll hand back to Bridget, if not. I think we'll hand back to you then, Bridget.
Sorry, struggling to get off mute. Yeah, that's it from me as well, thank you.
Brilliant, thank you Dave, thank you Helen, and I know you're going to stay with us now for the Q&A session. So that's great. So by some wonderful wizardry in the background, I've got questions that you've all been asking. We're going to do that for a few minutes before we break for lunch, so that we don't lose the moment. So Una May, if I could welcome you back, and you've been asked to provide some examples of the communication campaigns around responsible use.
Great, well, thanks for getting me back again, and this time I'm off mute, I hope. So yeah, I guess the main campaign we carried out was the Outdoors for Everyone hashtag, and what we did was we looked at what were we brought together, as I said, over 30 organisations to look at what the challenges they were being faced with. So that was like the as I said, the forestry people from parks, the local authorities, and the big issues which have been mentioned a few times already around littering, dogs, fouling, parking, all similar kind of trends that we're seeing across everybody. And we developed a whole series of short little social media, I suppose, assets that all of our partners could all share, so that we'd have a common thread across all the agencies. So they were very successful, actually. We also worked in partnership with an organisation called Leave No Trace, particularly focused on the littering problems, and that was a very successful campaign. And we worked with Mental Health Ireland and the department. Well, it was mainly Mental Health Ireland around and Go Green exercise around Nature Moves, which was really about, that was in the early stages of the lockdown, to help people, to just encourage them to just get outside and just be moved by anything that they saw in nature. And we tried to expand that one to ensure that people would understand that even for those who were, I suppose, specifically those who are cocooning, that they would identify the value of just even looking out the window and engaging with nature through their window, but also then to work with people to encourage people to connect with nature. So the added value of connecting with nature and not just being in nature was the key to that one. So a bit of a mixture, better, engaging with nature, and then the whole responsible use of the outdoors were the kind of key programs, including, as I said, the Leave No Trace one.
Thank you so much. And you have a follow-up question. So it would be good to hear more about the barriers for specific target groups that Sport Ireland have found in your research.
Well, interestingly enough, today we've just launched one on teenage girls. So that teenage girls have a multitude of complicated issues that I suppose get in their way around, association with the word being sporty or not being sporty, being rural, their need to be more independent, and their willingness to kind of be a bit more adventurous, the lack of opportunities they're getting in variety of sporting activities. And they actually specifically have identified the outdoors as something that they'd like to do more of. So that's been very interesting. With the men over 45, it was kind of interesting, and I suppose our whole campaign was about, targeting the idea of no more excuses. They admitted themselves that they were the best ever at making excuses, that, if they got out and shortly, then it'd be fine if they waited until after the cup of tea or whatever. So we looked at that in the men over 45. The women's over 40 project hasn't started yet, and the diversity and inclusion project is underway as we speak. So we haven't had the insights yet on that one. So I suppose the most relevant ones are the men over 45 and the teenage girls. The teenage girls, as I said, is being launched today, and we've developed a whole area around toolkits and supports for people who are developing programs for teenage girls to I suppose pick up on what it is, not just the barriers, I suppose, but what are the key things that interest them, and the whole thing about they have a lovely, they love the sense of achievement they can get from achieving something, so targeting that, and as I said, particularly with this conference in mind, their interest in being more active in the outdoors has been really insightful for us, because that's not something we would have expected. You know, we thought we'd be looking at dance and yoga, and in fact they actually want to be more adventurous, so that's been useful for us to know. The area of being competitive or not competitive is something that challenges them on an ongoing basis, and particularly for girls, because you know the numbers are so much lower in girls that in competitive sports, you know, they're kind of, you're either all or nothing. You're either good at the sport or you're not, and then you feel if you're not good at the sport, you drop out. You know, and that's the view that they gave us. Whereas I suppose for boys, they tend to be kind of A, B, and C teams, so they have other alternatives. So those are some of the insights, really, without spending too long on it.
That's fascinating. I think we'll all be looking for your teenage girls' insights, because I think that's an area that certainly most of our organisations probably struggle with. Thank you so much, Una. That's brilliant. I'm going to move on to Bridget now. You've got a couple of questions. Is green health a known phrase? Is the first one.
It certainly is in Scotland. We made a decision quite early on that we weren't particularly comfortable with green exercise because of the connotations of exercise and yes, people being perhaps scared off that it's all about physical activity. And of course, we know that active and passive engagement in the outdoors and with nature is very helpful and provides health benefits. So green health isn't ideal, but we've gone with it, and green health partnerships seem to have yes, rung true with our local partners. Just a curious anecdote, I barely ever watch breakfast TV, but during COVID and working at home, twice in the last 6 months, there's been a wee snippet on BBC Breakfast TV. The first one of which, last year, the reporter literally, they were talking about the health benefits from being outdoors, and the reporter literally did say, yes, I'm using this phrase green health, and yes, that seems to be quite apt. And yes, it was again mentioned in the recent National Trust and concerns about footpath erosion. So it seems to work for us.
Great, thank you. And you have a lovely question to follow up. So if you gaze into the future by a few years, what would you hope that green prescribing will have delivered for patients and the NHS?
I think one of the absolutely key things that we would love to envisage would be yes, having opened hearts, minds and prescription pads of the healthcare sector. It would be great to think that pointing people, referring people to supported green health projects was being routinely embraced by the health sector. And I think, as I've been stressing, the wider package of work activities delivered by the Green Health Partnerships, the dedicated member of staff and the wider, I think just that sort of wider and groundswell of awareness, of appreciation within the public of, oh, this isn't hippie or weird or yeah, and actually it is valued by the public for the way that they can regularly connect with local green space and yeah, get involved and recognise the benefits. of a daily dose of physical activity and mental refreshment too.
Fantastic, thank you so much. I'm going to throw the last question and then we're going to stop for lunch, which I will come to in a moment, to Dave and to Helen. So one of the questions is that it feels like the biggest effects have been suffered by urban communities. How can the countryside sector help with having significant negative impacts on rural, help without having significant negative impacts on rural communities and conservation?
Good question. Something I can chip in first with some of my views on that. I think it's right. Yeah, we have seen, you know, that the urban communities having suffered significantly, and that's around access and accessible green space. I think some work we're doing in that training is look at green infrastructure standards. So coming right back to how we engage with planning of urban spaces, and also I think the role of local parks and use of local parks. And I was at the all-party parliamentary group on parks and green space, took place last Monday, and there's a big focus on health and the environment and the role that parks needs to play in a healthy recovery from COVID-19. So that fills me with some confidence there. I think the countryside sector, I'm trying to sort of interpret that question in terms of what the countryside sector means. I think my reflections back, I suppose, would be, you know, with this increased focus on being outside and the focus on the role that nature plays, how can we galvanise that in terms of how people connect with nature in a respectful and proactive way? And I think the work that we're doing on refresh of the countryside code will be key there, and the messages that we get out over the next few months around how people engage. And I think there's something about sharing, I think, and this sort of potential sort of separation between the urban and the rural. Actually, how do we bring those two communities together? I'm sort of quite close to, you know, in Greater Manchester here. So how do some of the sort of Manchester fringes that have really close connection to the Peak District, how do they engage? We see a lot of wildfires on Winter Hill every year up here. So how do we use that sort of love for a local area and really engage communities in protection and support for those areas?
I'll just very quickly add that, yeah, I think one of the big focuses for us in DEFRA at the moment is the Glover Review, which I expect you're aware of. And a big part of that is how do national parks and AONBs connect with people. It's a question of, you know, physically how do people access those areas, but also breaking down the barriers of people who think, oh, it's just not for me. How do we get those involved? I don't think there's a magic bullet, but I think there's some really good local initiatives going on. So one that springs to mind is the South Downs National Park. Have kind of twinned with an urban playground and a playground in their area, so that when kids go to the playground that's maybe a bit further from home, that's kind of familiar play equipment. So I think there's really good local initiatives that can help with this, but it is something where, you know, I think we're still all working through it as we go along. So I'll keep it short because I expect everyone wants their lunch, but that's it from me.
Lovely, thank you all so much for answering those questions. That's been really, really insightful. I'm going to keep this very brief. Thank you for your contributions this morning. We're going to move to our lunch break now. If you would like to join the networking opportunity, then the access link is in the delegate pack and also in the chat pane now, and we'll be on there from 12:30. So come prepared to sort of have a very informal and relaxed networking session with your sandwiches. If you don't want to join that and you want to go and take full advantage of the gorgeous sunshine, then we will restart promptly at 1 o'clock, and we'll be working through till 3 o'clock when we come to an end on the who is missing from the outdoors side of things. But for those of you who are going outside to enjoy the sunshine, there is a small competition that we're going to run in terms of taking a photograph of what you're going to do in your lunch hour and sending it to the Twitter feed #ORN Inclusion. and tomorrow we will be awarding a prize after you've all voted on the best. So I look forward to seeing you at 12:30, if not 1 o'clock. So thank you very much.